What are the main factors that you take into consideration before a treatment approach is decided on?
Yeah, we always have to remember that treating a patient is also treating a person. So it's not just about what the disease the patient has, but who the patient is. And so we take into consideration goals that the patient has, as well as other health factors that may be taken into consideration. For example, the patient may have high blood pressure or a heart condition. But regarding the disease, we really also take into consideration what the profile of the disease is, maybe how much disease burden the patient has, and some genetic factors that may impact our decision making.
What is the patient's role in treatment decisions?
The patient should always be the center of the decision making. I think that's a really important thing for us to remember because ultimately it's the patient who has to take care of or has to make the decision and has to withstand the treatment. Alongside of that, there may be some caregivers as well, but the patient has to, number one, understand the disease, and number two, understand the treatment options. So it's best if the patient has as much information as possible.
Are treatment considerations different for patients with relapse disease?
For patients with relapse disease, there's a lot of things to consider that may not have been true when the patient was first diagnosed. For example, you always have to think of what maybe the patient had as a prior as a prior treatment, and also how the patient tolerated it.